Before you invest a lot of money and time into setting up a texting program, you need to do market research to understand your audience. Does your audience like text messaging? How do they text today? Would they be interested in signing up for a texting program from your organization? Why or why not? You can't buy a list of cell phone numbers and text people without their permission. They have to agree to participate. This is called opting in. Getting people to opt in is a challenge, even when people are interested in the information. So even if you craft the best text messaging program with the most important messages, you need to think about how to best market to your audience to encourage as many people to opt in.
Here at Public Health Seattle and King County, we wanted to offer a program to text employees on their personal cell phones during emergencies. These emergencies could be situations such as clinic closures due to snowstorms, health and safety guidelines during disasters, or updates during crises. We conducted a survey of all employees to find out what they wanted from us. We found out that our employees had very strong opinions about getting text messages from work. Just one email asking people to give their opinion garnered 800 responses from our employees, which is a 50% response rate.
Text messaging can be a really effective way to communicate with employees during emergencies, but not everyone's going to want to sign up. Let's hear from a couple of our employees.
Emergency text messages? It's about time, finally. Everybody's texting now. We're in the modern age.
No thanks, checking my phone is just another thing to worry about.
It gives me peace of mind to know that if something goes wrong, I'll get the information quickly.
I want to get paid for my time spent on the phone. Are they going to pay for my texting bills?
It's convenient, fast, and I don't have to check email on my computer.
I don't want work to track me down on my personal phone. I need downtime without interruption.
Well, it allows me to be efficient and save time. I love it.
I can be reached the way I've always been reached. Just email or call me.
I guess we'll have to agree to disagree.
I guess so.
We addressed their key concerns in the opt-in email. We told them we'd focus only on real emergencies that affect them and would be judicious about how often we text them. Of course, we said they could opt out at any time. Texting isn't for everyone, but you can increase opt-in by being clear about your goals and plans with the texting program. People are interested in receiving emergency information by text. A random digit dial telephone survey of 400 texters in King County found that 83% of people said they would be likely to sign up for messages about emergencies. 46% said they'd like to sign up for messages about emergency preparedness. And a much smaller number, but still a substantial 26%, said they'd sign up for health tips from the health department. So while getting people to actually act on their interest by taking the time to opt in could be an additional challenge, in general, people are enthusiastic about the concept. You may want to reach people from different communities within your jurisdiction. Don't assume just because people share a particular ethnic or other type of commonality that they think the same way about text messaging. We can't assume that people are using this technology for the same reasons. We conducted in-depth interviews with over 100 people from several different communities, asking them what they liked about texting and why they used it. We used a type of audience research method called Q method. People rank order opinion statements according to how much they agree or disagree with the statement. The data are factor analyzed, and what results is groupings of people who think in similar ways about a topic. In this case, the topic was text messaging. We then give each group a name to help describe the texter type. Among Spanish speakers in King County who text, we found three main types. The fully embraced texter is very comfortable with texting and uses it for many functions. This type of texter messages friends and family daily and coworkers weekly and is very likely to sign up for text messages from the health department. The security texter uses text to stay connected with family that may be far away. Text messaging allows them to feel safe and secure in different situations, keep in touch with their families wherever they may be, and alert one another to potential dangers. The coordinator texter typically uses text to primarily coordinate their work and make plans. A typical coordinator texter does contract work and finds out about new jobs and schedules them using texting. Think about how you would use this information to develop and market your text messaging program. It'll probably be easiest to recruit the fully embraced texter to a public health texting program, since they like all aspects of text messaging. The security texter would likely be interested in getting texts to provide critical information to loved ones and to stay safe. But to reach the coordinator texter, you may want to emphasize how public health emergency information can help him figure out how emergencies might impact work schedules.
Another community we interviewed are people who are deaf and hard of hearing. They tend to be early adopters of texting technology, and many rely on it for daily communication. So they are an ideal target audience for texting campaigns and programs. Our research with the deaf and hard of hearing community revealed several types of texters. We thought it would be great to hear from them about how they use text in a game called the Texting Game.
Hi, everybody. Welcome to America's favorite game show, The Texting Game. Please welcome your host, me, Rodney Sherwood. Hey, everybody. Welcome to our show, where we make a match of dynamic demographics with purveyors of pivotal public practices. Hi-ho. Try and say that 5 times fast. This week, we tackle texting. Let's meet our participants. Texter number 1 likes to stay busy with volunteer work and rock climbing. Let's say hello to Convenience Texter. Texter number 2 enjoys swap meets and fantasy baseball. Let's have a big round of applause for Informational Texter. Texter number 3 plays volleyball and hosts a weekly supper club. Yummy! Let's meet Social Texter. And finally, he enjoys focus groups. He has your best interests at heart, and he loves keeping you informed. Big round of applause for Public Health Official.
Hello, everyone.
Gee, hi. Also, welcome our interpreter. So, Public Health, do you have a question for one of our texters?
Yes, I do. Convenience Texter. What is important to you about texting?
I like being able to get and send messages while doing something else. It's efficient, short, and to the point.
Do you feel like texting is just a fad?
Texting is the way we communicate now, so no, I don't think it's a fad. I think it's here to stay.
Excellent. Informational Texter. What do you think about text messaging?
I'm not someone to text all the time. I'd rather just meet in person. I don't text for conversation, but I do text to get or send information.
What are some examples of when texting works for you?
I text to let people know if I'm running late or to finalize plans. I also feel safer because I can text if I'm in a dangerous situation.
Very interesting. Social Texter. You must see the value in texting.
Yes, I text all the time. I'm addicted to it. I feel like texting helps me stay connected to my friends, the family, the whole world.
What kind of freedom does texting give you?
Texting is so fast and easy, and everyone in my family texts, so we keep up on news and events. Makes us all feel closer. It's a fun addiction, and texting gives me independence.
Fantastic. What I'm getting from all of you is that you use texting to stay informed, whether that's with family, friends, or what's going on in your community.
So, Public Health, how are you going to serve this gorgeously diverse group, huh? Will you send occasional preparedness alerts to texter number 1? How about random health tips to texter number 2? Or perhaps friend requests to texter number 3?
Rodney, I think I can best meet all of their needs if I focus on what's relevant to their community. By sending out emergency alerts only on topics that would directly affect these 3 texters and their community, I think I can get them to opt in. And that means increased access to critical information.
Texters, are you ready to meet your public health official?
I'm so excited.
I don't blame you. Hi-oh, have at it. Well, there you have it, folks. Another happy union between common sense and community. Until next time, bye-bye, everybody.
Uncovering all the various uses of text messaging is important for several reasons. First, it shows the diverse ways people use this technology, including to access information and to communicate when they need help. For some people, it's a true lifeline that public health organizations cannot afford to ignore. Second, knowing something about your audience helps you market your texting programs so that you can reach as many people as possible with critical health information. For example, if you were marketing to deaf and hard of hearing individuals, you might include in your materials appeals about how it provides peace of mind. Another approach would be to emphasize how they can get information directly to their phone quickly and to keep them safe and secure. A common thread across all the people we've talked to about texting is that they want personalized, relevant text messages sent on a limited basis. You're entering your subscribers' private space when you text message them. Make it count.